As you've heard this morning, we are going to hear from Bendigo Health, which is the other major partner in this initiative. And of course, because it's not a prescriptive model, so it's being implemented in different ways in different settings. So it's great to have a regional partner as well. And we're going to hear from Peter Faulkner, who's the Chief Nursing Officer at Bendigo Health, about how he has implemented there. So thank you, Peter.
Thank you very much, Heather. Great privilege to be here today, meeting on Wurundjeri country. I pay my respects to elders past and present and all the nations who may be represented here today. It's a great privilege to be in, I think, in the health business and do all the good things that we do, and it's a particular privilege to be involved in this project. I'm going to refer to it as the project rather than the long title, if you don't mind. Michelle talked about the importance of governance, and we did, of course, nominate an executive sponsor, which is me, and as a bloke that's a little different, I suppose, in some respects, but as a husband and a parent of two daughters, I thought this was important, this was the right thing to do. So we put in place an implementation steering committee, which was our kind of governance mechanism, and I had a group of very committed and hard-working people that really did the work. I tried to manage up a little bit on their behalf and create an environment where this could make a difference. Little did I know at the start of the process that our family would be deeply touched with my sister losing her daughter at the hand of a partner some 6 months ago. So it has taken on a particular personal relevance for me. Bendigo Health is a regional public hospital, as I'm sure you're mostly aware, secondary referral hospital servicing the Loddon Mallee region, 25% of land mass, not 25% of the population. We're also the regional psychiatric service provider, providing psychiatric services across that community. And we do have an array of community and continuing care services and large public sector residential aged care. We employ about 3,500 people, turnover $300 million, so a big economic entity and the biggest employer in our city. We know that in regional Victoria, family violence is a critical and key issue. Women are far more likely to be victims of family violence than those in metropolitan areas, or at least more likely to be identified. And the rates of family violence in the city of Greater Bendigo have increased by more than 150% in the last 5 years. So this is a matter of great importance, relevance and significance for us. Rural and regional victims of family violence do face specific issues related to their geographic location and the cultural and social characteristics of living in small communities. So there are some specific challenges, I think, for regional and rural communities. We, of course, undertook the implementation in a staged approach. We developed a number of products and trialled various things. We certainly started by looking at the lack of policy and guidance that we had in our organisation for our staff. I very much believe that people, our staff, want to do the right thing, but it's also absolutely important and critical that they know what the right thing is. And that's the purpose of policy and protocol. So we developed our family violence protocol, our assessment form, and we've embedded those things within our repository of these of guidance, staff guidance on what we prompt, and I think many people in the audience may be familiar with it. With our workforce, of course, we started our response approach, and prepared our training for our clinical and senior management staff. So we took the approach that it wasn't just training clinical staff, but it was also about training our senior managers. We've trained about 200 staff so far in the modules of training to raise awareness of the issue and to further their learnings around a sensitive inquiry and the 6-step model of sensitive practice. And 19 of our senior managers have attended the Vic Health leadership training. So we saw both of those as important elements in the project. We have heard of the importance from our friends in America of having good outcome or quality improvement measures. So we identified very early on that we had poor data. We couldn't really identify with any accuracy or robustness what the prevalence was and what our response was to those instances of family violence that were identified. So we developed a data capture mechanism which we've embedded. We have a tab in our patient administration system, a referral tab, and so it actually sits within the day-to-day PAS as such, and it not only is designed to capture data, but it facilitates service planning and supports reporting, which we think those three elements of capture, planning and reporting are key. So we're very pleased with this initiative, and part of the training, of course, locally is to focus on capture and use of the tool that we have developed. The second stage of our project at Bendigo, and in responding to the statement of priorities in the current year, our advisory group we've established as an enduring element within the organisation, shifted it from an implementation project group to a family violence advisory group. So very much embedding it within the organisation. Bendigo Health has as two key strategic visions, healthy communities and world-class healthcare. So we're very committed to embedding our activities around family violence as part of our healthy communities push. So not only looking at what we can do in strengthening our hospital and other hospitals' responses, but also what we can do in the primary prevention space. And I was absolutely delighted listening to the Coodabbeens on Saturday of this week, and a number of stories of football clubs that have adopted a charter against family violence and actually having the dialogue at the sporting club level, something that I'll be taking home. So we've also continued to roll out our education to the pilot sites. We're extending the program to our acute inpatient units. Embedding and consolidating is critical. We've been educating our ward clerks and admission clerks in relation to the data capture element, and educating our health information staff for family violence filing in our medico-legal tab, which is our kind of mechanism to provide some security and privacy and confidence to victims that their information is protected. We have our mentoring and supporting demonstrations and our regional sites toolkit. I've had the opportunity to provide all of our resources to every director of nursing in our region, and I'm sure they're all beavering away doing their bit to make a difference. We have a vision to continue to roll out education across all areas of Bendigo Health, to extend the family violence assessment and response protocol and associated document documentation systems and processes into our dental and community and subacute services. Little known fact, Bendigo Health has the largest public dental service outside of the dental hospital. So we see about 250 people per day in our dental service, most of whom are children. So we think that's a very important area of focus for us. We are working to embed the data capture, to evaluate the impact of our initiatives, to continue to build partnerships with the family violence sector. I've probably underplayed that a little bit. Very much part of our overall implementation and our response was building those relationships concurrently with our internal work, so we had very clear referral pathways and very clear understandings of support that is available, and building strong relationships that were probably fairly tenuous previously, much to do with our behaviour, I suspect. And to continue to promote the Healthy Communities vision through our Healthy Communities strategy and through our community engagement. This matter has absolute commitment from our Board of Directors. If I've made a contribution, I'd like to think that's my little bit of help, is to really get it elevated. Our Chief Executive has always been very supportive, but our board are very much committed to this. We're delighted to be a partner with the Women's to benefit from the terrific work that they initiated, and with our watch. This is, a critical and important issue. We say no to family violence at Bendigo Health, and I hope that we can help you in some way, and to our online friends to do likewise. Thank you for your attention.